Carpal tunnel syndrome is a very common hand problem that results in numbness and tingling, often in the thumb, index, middle, and part of your ring finger. However, sometimes the severity of symptoms are such that the patient may report the entire hand feels numb. The anatomy of the carpal tunnel is that diagrammatically, the back of the wrist is a series of bones that form an arch. And the palmar side has a ligament that crosses, that connects one bone to the other. So within that confined space run a number of tendons and the median nerve. And so over time, if the tendons start to enlarge in size, then the nerve starts to get less and less space available to live and starts to get squeezed and compressed and kind of flattened underneath that ligament. And so sometimes that anatomy needs to be changed either with a medication or surgery in order to relieve pressure on the median nerve. A lot of patients come in and ask what caused their carpal tunnel, and they may have many ideas and thoughts about activities that make symptoms worse. In the majority of cases, carpal tunnel's primary cause is unknown. It's what we call idiopathic. And so it's really an anatomy problem about the way that we were born, where the nerve ended up being placed in a confined space with the tendons anatomically. And so if we were born where that median nerve were outside of that tunnel space on the other side of the ligament, almost nobody would end up having a median nerve compression problem at their wrist. Unfortunately, for patients that have symptoms with that nerve being inside the tunnel, they develop numbness and tingling that can be increased with certain activities. And so although some activities such as driving, typing, or using a mouse could theoretically increase symptoms, they're typically not the direct cause of the problem. Often patients may get the symptoms also at night, but sleeping doesn't cause carpal tunnel syndrome. The symptoms associated with carpal tunnel can be a little bit variable, but most patients will describe some type of sensory change. A number of words that are often used include numbness or heaviness of the fingers or hand. Some people will describe their fingers as feeling fuzzy or fat. They may have extra sensory symptoms such as tingling, burning, pins and needles. Sometimes the symptoms will be described as painful. Another symptom that may be described is dropping objects. And so they may have a glass or a dish that they're holding and suddenly that falls to the floor. And so the loss of awareness of how hard you're holding something can happen. You can also develop some thumb weakness as well, where it's difficult to maintain the same pinch strength when the carpal tunnel becomes more severe. To diagnose carpal tunnel, in many instances that can be done just by the history that the patient provides in terms of symptoms, timing, events that increase or decrease symptoms, as well as their office physical exam. Many times that history and exam are sufficient to be able to make the diagnosis of carpal tunnel, since it does have some characteristic findings and is a very, very common problem that we see. Other times, if there are other conditions such as diabetes or associated cervical spine problems, previous surgeries, it may be helpful to get some other tests that may help support and rule in the diagnosis of carpal tunnel, or possibly rule it out and find an alternative explanation for that numbness and weakness. The two most common tests that are ordered include a EMG and nerve conduction study, or an ultrasound. Some of the non-operative conservative treatments include wrist splints that are used part-time. We mostly advise using those initially at night to sleep, since that's the most common time that symptoms often develop, and then part-time use during the day. There may be some types of activity modification that can be done in addition to splinting, such as adjusting position while driving, adjusting workplace parameters such as the height of a keyboard, the height of your chair, etc. And the goal would be to try to have the hand and wrist be placed in a more neutral position. So by keeping the wrist in that mid-neutral position, the splint can minimize or reduce symptoms. If the symptoms, however, progress and the numbness and tingling are occurring even with the splint on, then additional treatment would be appropriate. And that often would include a steroid injection, sometimes some occupational therapy to work on some nerve gliding, range of motion exercises, reduction of swelling. And then finally, if those other modalities are not successful, there are options for surgical decompression. The surgery, it turns out, is actually the most reliable treatment because it changes the anatomy most distinctly by splitting the ligament into two separate pieces and allowing that pressure to be relieved from the nerve very rapidly. A small incision is made in the palm of the hand, and the ligament that crosses the palm is exposed, and that ligament is split into two pieces, allowing the median nerve to, in a sense, have an unlimited amount of space. The recovery after carpal tunnel is often relatively quick and allows somebody to return to their normal function within days to weeks. In the patients that I take care of, I usually ask that they wear a dressing post-operatively full-time for the first week. And at that point, we would have them return to see us after surgery for a wound check and to see how their motion of their fingers is coming along. Some patients may ask if they can do anything to prevent the development of carpal tunnel. And although sometimes changing your position while you work or drive could help reduce or prevent symptoms, many of the times the development of symptoms are actually unpreventable. With carpal tunnel, we don't know exactly why it occurs, and so we don't have great solutions for how to prevent it. And so more important than prevention is recognizing what it is so that if symptoms do develop, that you can come seek care from an experienced provider and receive treatment early on where you're more likely to be able to improve your symptoms without need for surgery.